Are your children vaccinated against measles?
No.
Come on now. Come on, what are we doing? Today we are breaking down episode 14 of HBO's hit medical drama, The Pitt. During this episode, we see the situation where a kid that has contracted measles appears in the ER and the doctors on staff have to handle it, which is eerily timely because this situation is playing out in this country. Right now, the US is dealing with a pretty intense measles outbreak, specifically in Texas. And so this is kind of a really interesting TV to real world parallel. And this is also a really precarious time to have this outbreak because our elected officials are currently gutting public health programs across the country at a time when we need it the most. So let's dive in, let's see what happens.
It's got a weird rash too.
Oh, and it's maculopapular on the legs.
Pretty faded on the neck and chest. Starting to desquamate.
You ever seen anything like this before?
Nope.
Me neither.
Well, that just goes to show you how old I am. This looks like measles.
Oof, he really is old. So the reason Dr. Robbie says that is because measles really hasn't been a problem for the last 20 years. In the year 2000, it was officially declared eliminated in the United States. At the time, the government was pushing a pretty aggressive vaccination program that made sure that over 95% of the population got 2 doses of the MMR vaccine. Since then, measles, we've seen it every now and then, but it was never really a big deal until recently. As of April 11th, there are over 540 confirmed cases of measles in Texas, and 2 children have tragically passed away during this outbreak. It's quickly spreading across to other states like Oklahoma and New Mexico. So while totally unintentional, this show is depicting a real life situation that is playing out all across the country right now.
How did Flynn get measles?
From his sister. Hi, I'm Dr. Robbie. Georgia is fine. She's in our staff room. She's the one who actually called 911 and probably saved her brother's life.
So, not so fun fact, measles is highly contagious. To put it into perspective, a single person with measles can infect up to 12 to 18 people that are close to them if they are also not protected with a vaccine, which that's insane. That's such a high number. Things like the common cold or the flu have a significantly lower chance of infecting that many people. The way Dr. Robbie is describing it is very, very accurate to how it actually plays out.
Georgia was sick, but she got better on her own quickly.
Yeah, many people get better on their own, like Georgia. However, as many as 1 in 20 kids that get measles get pneumonia, like your son.
The stat he pulls where 1 in 20 develop complications is a real statistic, and a lot of them do end up developing things like pneumonia. They could even die. This is a real issue. Here's another stat. Approximately 20% of unvaccinated people who get measles end up in the hospital, which is again just a wild number. Though it might not feel like it anymore, this disease is still incredibly dangerous, and it's something we should be protected against.
Are your children vaccinated against measles?
No.
Come on now. Come on, what are we doing?
The MMR vaccine is perfectly safe. Measles is not.
Once again, Dr. Robbie is correct. The measles vaccine has been proven over and over to be safe. With 2 doses, you have a 97% chance of not contracting measles. And there's just been so much research on the measles vaccine, and there has been no credible link to prove that they are dangerous. Beyond the individual level, though, there's a community element. The more people around you who are vaccinated against things like measles, the less likely it is for those diseases to spread. Just throwing that out there. So the broader implications of this whole thing is that the US is vastly underprepared to deal with this type of outbreak. The current head of Health and Human Services, Robert F. Kennedy Jr. as well, he's the most famous anti-vaccine extremist. He's done some really awful things to spread misinformation around vaccines.
There's no vaccine that is, safe and effective.
He's made sure people just generally feel unsafe about it. During this whole measles epidemic, he's spent his time promoting alternative medicines like fish oil, but he's not been okay with the government mandating the measles vaccine because he believes that we don't really know the risk. So he's a terrible leader to have for an infectious disease outbreak. On top of that, there's been just massive layoffs across the public health departments in the US government. Places like the FDA, the National Institute of Health, HHS, they've laid off approximately 10,000 employees, which basically means, on top of having poor leadership, we are also just understaffed to deal with the problem. And to top it all off, we've just had some pretty key departures, like Dr. Peter Marks, which is the FDA's top vaccine official. He resigned recently, and so people like him are leaving the administration. They're citing conflicts with this new group of people that don't believe in science necessarily and are very much just running these agencies into the ground. In summary, we have bad leader, we've lost 10,000 employees, we've cut a lot of valuable programs, and we've lost some of our brightest minds who work in public health. So this is a really bad time for a measles outbreak. So scary situation aside, here are a couple things you can do in these trying times. You should stay informed. Rely on reputable sources of information. Make sure that the people you are following are actively looking out for your health, not their bottom line. Make sure you and your family are up to date on your vaccinations. You can request your vaccination records from your doctor to see like what you're missing, what you might need to get updated soon. Support leaders who care about your public health. The current administration, the current people in charge, very much have done things that prove they are not interested in your health and safety, so you shouldn't support them. That's my take, at least, you know? You should support people that do care about that. And there are people across this country working for your health right now, so look into them, find them, support them. This episode highlights, just one case of a child really going through it after developing a disease that shouldn't be around anymore. But it's also just a real life indicator of like what's happening across the country. With our public health infrastructure under attack, it's more important than ever that we recognize the importance of vaccinations in our society and work to build a healthcare system that really works for all of us. So my camera actually died before I could record that last scene, but anyways, stay safe out there, y'all. And if you like this video, comment, like, and subscribe. We want to hear from you. We want to know, what things you want us to explore, what questions you want us to answer. Let us know in the comments and we'll make it happen.